Good morning, everyone. I'm Megan Culliff, along here with Scott Micklin.
Good morning. It is Tuesday, May the 19th. Yes.
Yeah.
I almost lost track.
I know.
Right?
I saw that.
It happens.
What day is it?
What day is
Where
it? We just had the 18th. It must be the 19th. Yes.
Yeah.
So, welcome.
Days don't matter anymore, so.
You know, it really doesn't. I've heard that time is fluid. But there you go.
Mm-hmm.
Yeah. But it's great to have you all with us, everyone. This is our local information program for COVID-19, presented by KSJE in cooperation with our partner station, KNMI. You can hear this program at noon every day over there, Monday through Thursday, and again, a rebroadcast on KSJE every afternoon at 5:06 on the radio. So it's great to share all the information with you.
It is. We enjoy it.
We do.
I love it.
Do you?
Yeah, it gives me a reason. It's like, it's nice to have a reason to get up, get ready, and go somewhere, especially during this time. We lucked out
Right.
on that.
That's true.
Yeah.
I do appreciate still being able to come to work and to do a show and to
Right.
share information with people. Mm-hmm. And it's nice to have a person to talk to,
Exactly.
than just the microphone.
You're the only face I've seen really in person.
Right? I'm
during
so
this
sorry.
time. Yeah,
I'm so
exactly.
sorry. Well,
wow. It's like
raise the bar a
Groundhog
little bit
Day,
higher next
and I'm
time. Next
stuck with
pandemic.
Scott. Yeah.
Next pandemic, a little higher. Yeah. Anyway, we'll start with some numbers. Today, right? Numbers on Tuesday. So I will do that, and I'll check real quick.
While you check real quick, we had a rise in numbers nationwide. 20,000 new cases since yesterday.
Wow.
Yeah, that's pretty much it seems to be the daily increase across the nation usually.
Okay.
So.
That seems a lot high to me.
It is high.
So.
I mean, we're a big nation, but.
Right. But true. All right. New Mexico has now had over 6,000 positive cases. We were telling yesterday just how close we were, about 5,900. So it makes sense. Another 165 cases around the state. San Juan County had additional 34 cases yesterday, 5 additional deaths in our state, and one of those was in San Juan County. And then on the recovery side, we had 41 additional recoveries, which is
great.
Good news, too. We always like to see that as well. And again, with these day-to-day numbers, it's kind of hard to get the overall trends. And so that's why on Thursdays we like to show those numbers from San Juan County that they compile about the 7-day averages, because that kind of evens out some of these ups and downs of these daily numbers.
Yes.
So
there's finally more recoveries than new cases, though, in San Juan County.
That's true.
There you go.
So there you go. That's very true. But those are statewide recoveries.
True.
So sorry to be a Debbie Downer.
Jeez.
But I'm sorry about that. KSJE.com is where we're compiling all these stories, of course. Whenever there's a local COVID-19 story, we put it on there. You can check that out. The daily statistics, more in-depth from the State Department of Health. The updated Navajo Nation numbers from yesterday. Again, we had a big increase because I think there were several days that we related to yesterday. From Sunday to Monday numbers from the Navajo Nation, there were 69 new cases, total of 4,071, and 2 additional deaths on the reservation as they continue those curfews and on the weekends and really try to get more help out there. Of course, we talked about the supply drive here at San Juan College, sending out a lot of supplies to the reservation, and again, just hoping to help keep folks at home so they don't have to travel around and maybe risk spreading it or catching it or what have you.
Right.
So that's what's going on our website. Of course, we talked about San Juan College starting online classes for the summer, and the jury's still out on what the fall will look like. And so for the college and for local school districts. We talked to Aztec Schools earlier today about fall plans, but they are planning kind of 3 different scenarios of what that would look like.
Yeah, I'm sincerely hoping it's not just online schooling again.
Right.
That will drive all of us mad.
All of us parents? Mm-hmm. Yeah. I understand.
Yeah.
Well, maybe a few teachers too.
I think so.
It was certainly a learning curve for me to move my classes online as a teacher.
Totally.
Because there were things that I wasn't ready for. But
Even
now
you,
I am. Even
with
me.
all the buttons over there.
With all the buttons over here that I had. They really didn't help me in online classes. No. They didn't. But my students did well. I'm really proud of them. So I must say a shout out to them for making the transition and dealing with some of the frustrating parts of uploading assignments and dealing with this new situation. But
quite the adjustment.
But we shall see. So there you go. Very true. So today we have a guest who we talked to last week, a couple days ago, but nothing has really changed from that
Talked to
conversation.
him on Friday.
On Friday. So we have a costume change coming up. Everybody be
Not
ready.
me, though. Apparently, I'm wearing the same shirt, I think.
Are you wearing the same thing?
I think so.
We'll find out. I'm going to be different. I know. I'm going to lose the tie for this interview.
You are, yeah.
So it's going to happen.
It was a no
But this
tie
is
Friday.
Dr. Preston Harrington. He is a pediatrician. And so we are going to load up his interview right now and be able to hear what he has to say, because there's been a lot of new information about COVID-19 and children. That was the reason we wanted to have him on the show, right?
That's right. All the Kawasaki stuff, not the motorcycle, but the disease. And
thank you for making that clarification.
yes,
So I
and
think that's important.
symptoms displaying differently and attacking different symptoms.
Yeah,
displaying differently.
Yeah.
And attacking different systems.
Thank you. So there's that.
Yeah.
All right, so let's hear what he had to
Cool.
say, shall we? And then we'll stop talking. Okay, there we go. Here he is. Joining us now to talk a little bit more about COVID-19 and its effect on children, Dr. Preston Harrington is back with us from San Juan Health Partners Pediatrics. Dr. Harrington, welcome back to KSJE. It's great to have you with us.
It's good to be back, Scott.
Thank you very much. And we'll get started. Megan, I know you have some questions for Dr. Harrington, so I will switch it over to you.
Yeah, so it's been a few weeks since we talked to Dr. Harrington, and initially when we spoke with him, we were talking about maybe reopening of schools, how COVID's presenting in children, and there's been some recent reports that have come out that have suggested that COVID-19 not only can impact children, but that it's presenting in different ways maybe than adults. And so I'm wondering if Dr. Harrington can speak to that.
Yeah, we're still learning. I think the good news is still that kids do not get this as often or as severe as adults. So, for example, in our area, we've seen essentially no cases that have been confirmed, although we've had a few that were suspected positive, but none were requiring intensive care, anything like that, which is different from the adult experience. So we don't really know how many kids actually may have the virus and never have a symptom. The suspicion was that they could still spread germs, and that's why the schools were closed. But there's some evidence coming out that maybe even kids are less likely to be spreading this than we thought, which could be good news as far as possibly opening the schools in the fall. We'll have to see. But the children who do have symptoms will oftentimes have mild symptoms, and like we were talking before we started recording, it can mimic other diseases. So it can be respiratory, it can be gastrointestinal, where they have diarrhea. Not as many kids seem to have fevers as adults, although fever can be a part of it. And then the tip of the iceberg, which started showing up in New York, where there was just so much COVID-19, is this new syndrome that's being called MIS-C, or the multisystem inflammatory syndrome in children, which kind of bears a resemblance to some other conditions that we've known about in the past, one called Kawasaki disease and one called toxic shock syndrome. But this is, maybe a few dozen kids out of, a state with several million residents. So it's still considered a rare condition.
That is good news. So if I was a parent, what kind of signs should I be looking out for?
So for the new syndrome, or just for the typical COVID-19?
I think probably both, but especially this new syndrome, since we haven't heard a lot about it.
Yeah. So for the more likely presentation would be that your children are not sick at all, or that they have a cough with or without a fever, or some diarrhea with or without a fever. But the more serious condition would be sustained high fevers without another reason. And then these kids are sick, so they're not playful, they're not energetic, they're not usually eating and drinking enough, so they end up getting seen by a healthcare provider. And then there are other criteria, which would be different lab findings that go along with the name of multisystem inflammatory syndrome. So there are certain lab tests that will be elevated if you're having an inflammatory response. But what you would see before you got to the doctor or before you got the lab work would be just high fevers without an explanation and a sick appearing child.
Gotcha. And Dr. Harrington, can you talk a bit about the situation with masks these days. Of course, the latest report from the governor, she wants us to wear masks when we're out in public, and that involves, I would think, children as well. Some folks would say maybe they have breathing difficulties, or they feel claustrophobic when they're wearing a mask, or they feel that when they're inhaling their own exhale through the mask, that can cause problems. Can you give us some medical information about mask wearing and if it does impact people's health?
Sure, sure. So the American Academy of Pediatrics recommends masks for kids 2 and up, and I think that's just a practical thing. Trying to put a mask on a 1-year-old is just a fight, and then they're probably screaming and spitting, and there's probably more germ being spewed into the air than if you weren't wearing a mask. I think it's clear that masks are primarily for the benefit of the other people. So that if I go into a store and I wear a mask, and let's say I'm coming down with COVID-19, but I don't know it, I may already be spreading virus. And so my wearing a mask protects the cashier, it protects the other people in the store. I think that's common sense, really. I've seen things on social media that people say, well, I can't wear a mask, and I'm a little bit skeptical. Of course, I'm a pediatrician, but I'm not aware of any real danger of wearing a mask. The notion that you would be breathing too much of your own carbon dioxide is not actually accurate, because the mask doesn't completely close off. That would be more like if you were just walking around breathing into a plastic bag, something like that.
And you all don't pass out during surgeries, right, Dr. Harrington? I mean, you wear masks, don't you?
Right, and of course, pediatricians aren't in these long surgeries like some of the surgeons are, but they wear masks, and they breathe just fine. So I suppose there's always somebody who says, I have claustrophobia, and their health, that's between them and their mental health care provider. But I think wearing a mask protects you somewhat, and it's also primarily good citizenship to just avoid spreading your germs around to those who may be more vulnerable.
Yeah, that makes sense. And so I want to ask a bit about summertime activities. A lot of kids go to summer camp, either day camp, overnight camp type stuff. That stuff seems to have been at least postponed through June. Do you foresee a possibility of doing smaller outdoor activities with kids, maybe late June, July, or anything like that?
Yeah, I don't really know where that's headed. I think that my opinion would be that outdoor activities are very low risk, and so as opposed to putting a bunch of kids in a classroom with all the windows closed for hours at a time, I think having kids out running around in the open air would be low risk. I heard an interesting commentator suggesting that we start schools early around the country and that we start them outdoors, and I thought, well, I don't know if anybody else is thinking about doing that, but I think being outdoors is generally low risk for this virus. So I'd be in favor. My vote, if anybody's asking, if the governor wants to know, my vote would be that the outdoor camps and that sort of thing go ahead sooner rather than later.
Gotcha. Well, thank you, Dr. Harrington. And when we talk a little bit about some of these things, the gatherings, the social distancing, the physical distancing, all those types of things, I mean, again, there is some medical science to back up these types of things because of how this virus can transmit, and it's very different from other types of transmission, right, than flu or other things that we're maybe more familiar with. Can you just remind us about that?
Yeah, I think, and this is also something that's shifting over time. So you may recall when the virus was first coming, we treated it as though it were airborne spread. So there are some conditions like tuberculosis that are spread in the air, and what that means is if I breathe out and I have tuberculosis, the tuberculosis can hang out on tiny particles that stay in the air for hours and hours. Most people suspected that was not generally the case with this virus, that it was more like our more typical respiratory viruses, including influenza and RSV, which are droplet spread. Now, the droplets still come out of your mouth when you speak, or certainly when you cough or sneeze, but the droplets don't hang out in the air for hours at a time. They tend to fall relatively quickly, and the 6-foot recommendation has a lot to do with, and I'm not an expert on the studies, but the notion that when you speak or cough beyond 6 feet, the droplets are probably not going to hit anything, and they'll be falling down. So now, I wouldn't say this is 100% though, because there are some situations Certainly, like when in the ICU, there are certain procedures where they think the virus can become airborne. And I see reports popping up here and there suggesting maybe some of it's airborne more than we thought. So I would say stay tuned. But the party line seems to be right now that it is droplet spread primarily. And that's why standing 6 feet apart, and that's why wearing a mask should cut the transmission down significantly.
Gotcha. Well, Dr. Harrington, we appreciate your time, and of course, this is constantly evolving, right? I mean, even in your field, you all are learning more about this virus as more research is done and more cases are brought to medical professionals and things like that. I know it's hard to just say this is how it reacts every single time, and this is how we can treat it, and this is what's proving effective, because we're still learning about this virus. Correct? I mean, it's just so new, so novel that is why the situation is changing even day by day, week by week.
I think that's right. We sort of go with our best information. Originally, it was based on what we knew about coronaviruses in general, figuring, well, they're cousins, so they probably have similarities. Then over time, as you have more and more case reports coming in, you can start to gather information about, is this therapy better than this therapy? Should you wear a mask or not? And so people will say, well, why do they keep changing their story? It used to be don't wear a mask, and now it's wear a mask. That's the nature of science. It's sort of self-correcting. As you get more information, then you update. And next month, if we talk again, I'll probably contradict something I'm saying today. Who knows?
Well, not intentionally, though. Let's just point that out for the listeners. Yeah.
Not at all. You are a good source, and we appreciate that, Dr. Harrington. Thank you for joining us today.
My pleasure.
Thank you very much. That is Dr. Preston Harrington, San Juan Health Partners Pediatrics, our guest here on KSJE. And we are back here in the studio. Thank you, Dr. Harrington, for that.
That's
Again,
right.
information. Always changing, evolving. We're learning more about this virus, right? And I think that's what's maybe frustrating for folks, because they may see something that they read a month ago, and now we're getting information that what we knew a month ago is maybe different.
Right.
And a case in point would be the mask advice. The Surgeon General was saying, don't wear masks. Even Dr. Fauci, I said at one point, don't wear masks, and now that has now changed.
Right.
So
right, and part of that was
let me repeat that for my Facebook friends, some of my Facebook friends. That has now changed, Facebook friends.
Yeah. Well, part of it was just stop doing a run on the medical community's mask, right? And then once we started making homemade masks, then that's a different narrative. But in the beginning, it was all the people that were hoarding like N95s and stuff like that. Like, leave those for the docs, thank you.
Right. But again, the masks, just for folks who maybe haven't heard, but the idea is that if you are asymptomatic, you could be sick and spreading the virus. If you're wearing a mask, you are less apt to spread it inadvertently to somebody that you are nearby.
Right.
And it's really not to protect you from getting sick from somebody else. It's really to protect them from
Unless
you.
we all do it, of course. It's a contract in that way.
That social contract.
That's
We've
right.
heard
Keep
about that.
your germs to yourselves.
Thank you.
See?
Yes. Exactly.
Not hard.
No, not
Not
at all.
hard. Easy.
That's true. I'm going to open up the phone lines if folks would like to call in and give us a piece of advice before we run out of time this morning and go off the air for another day. But you have some information about llamas.
I do have information.
And you have been waiting patiently
to
share this all morning.
Seriously,
I just want the listeners and viewers to know.
Yeah.
Poor Megan, like a kid on Christmas, she wants to share this story.
To share about llamas. I've been sitting on my hands. Well, my personal algorithm sent it to me this morning. So,
alrighty.
Yes, okay. So, in 2016, a couple of scientists, one PhD student and a scientist in Belgium, started studying antibodies in camels, llamas, and people in the camel family. And
people in the camel family? Do you want to rephrase that?
Sorry.
Animals in the camel family?
Beasts in the camel family.
Okay, well, I'm with you.
You haven't heard about the half camel, half people?
Not this show. No.
Well,
okay.
Anywho, that's another day.
Yeah.
So they're antibodies, and whether or not those antibodies would be helpful in fighting coronaviruses. And so at that time, it was MERS and SARS were the viruses that they were studying. And so they would infect the llama, named Winter, apparently, with these coronaviruses and study the antibodies. And what they found, we just saw a comment that says llamas are trending.
There you go. Because of you.
Yeah, you're
Evidently.
welcome.
Hashtag llamas.
Hashtag llama antibodies. So anyway, so they discovered this immunity that was developing in these llamas to these other coronaviruses. So now they're,
Interesting.
infecting them with this coronavirus, and they're seeing promising results. Now, this would be specifically for people who have already contracted the disease. And so it would be a therapeutic intervention, not a vaccine type thing.
For folks who haven't.
Right, who
been
currently
infected.
have it.
I
Yeah.
see.
Yep.
Okay.
So
Interesting. Well, thank you, llamas, I guess, on behalf of all of us.
Well, and I would say, I lived on a ranch for a year, and llamas were usually actually pretty mean. So this is kind of
Yes.
like a redemptive llama story for me,
Well-
because they are mean, but they're protective of the other ranch animals.
I
It's
don't know if
very
they're
interesting.
mean or insightful.
What?
I'm just saying. Were you mean
Insightful?
to them? Maybe you were
What?
mean to them,
No,
and so
I
they were
don't
mean back to you.
Abuse animals? Are you kidding?
I'm just saying.
What?
I don't know.
No,
I'm still trying to picture you on a ranch.
Yeah,
That's
I fed
what
them,
this-
so I don't understand. Yeah, me on a ranch is a good image.
But it happened, apparently.
Yeah, I'm not lying.
Okay.
That's how I earned my keep.
Was that the Connecticut ranch?
No, that was in Texas.
Okay.
Yeah.
Just checking on
Yeah,
that.
yeah, yeah. The Connecticut ranch.
I don't-
The Canetians have ranches. That's what I call the Connecticut people.
Alrighty. I don't know what you'd call a citizen of Connecticut.
Canetian.
Canetian? Connecticut?
Connecticut.
Yeah.
I think we just
Connecticutite?
folks from Connecticut.
I guess so. I don't know.
It's anyway.
Interesting. Okay. Well, thank you for the llama story.
Yeah. So promising stuff, and and I think also I was searching for the deeper lesson, of course, and I thought it was really, you can imagine you're spending all this time, 4 years of your life devoted to studying antibodies in llamas and camels.
Yeah.
Nobody really cares but that corner of the scientific community. And then all of a sudden this crazy humanitarian crisis comes up and bam, you're in the spotlight. Your research is in the spotlight.
Well, that's how it happens sometimes. So
That is. So humbly stay the course and do your work. Who knows?
that's true. Very true. So thank you for sharing that. That's true. But I've heard that llamas and camels can be a little,
They're cantankerous.
yeah.
They spit and stuff.
Yeah.
And they really do. That's not just a
No.
thing.
Right.
It's a thing.
Yeah. It's
It's a thing.
They definitely do.
spit and they charge and they're big.
Yet we use them a lot on trails and stuff, right? Don't we use llamas
Some people,
on
yeah,
trails
yeah.
because they are good pack animals,
Yeah.
and in my limited understanding of hiking, that you can pack them with gear and their
can.
hooves don't mess up the trails like
Yes.
other types of animals might.
Yes,
So-
there's a few llamas that have seen the Grand Canyon and stuff. Yeah.
They can be somewhat domesticated, I guess, for lack of a
You
better
gotta
term,
domesticate
to
the
maybe
llamas.
help humans, but wow.
They could be very helpful to humans, apparently.
All right. Well, there you go. All right. Well, I think we are wrapped up the show for today with the llama story.
We'll end with llamas.
I don't know how we could end on a better note than llamas.
That's
really
the best note possible.
So there you go, everybody. Tomorrow, our plan is to talk a little bit about the blood plasma, a little update on
Tim, the blood guy's coming back.
that we've talked a little bit from BPL Plasma. And so an update from him, and then maybe on Thursday, in addition to hopefully doctors that we'll be talking to from the hospital, maybe getting an update from a survivor of COVID-19. So
Yeah, that'd be cool.
we'll look forward to that. But that's what's ahead this week, everybody, on our local information program with COVID-19. So thank you for joining us. Until tomorrow, stay well and stay safe. This is KSJE and our COVID-19 local information program, everyone. Have a good day.